The Model Systems Knowledge Translation Center presents Bowel Function After Spinal Cord Injury. This slideshow is based on research conducted by the Spinal Cord Injury Model Systems and serves as a resource for individuals with spinal cord injury and their supporters. The Model Systems Knowledge Translation Center is funded by the National Institute on Disability, Independent Living, and Rehabilitation Research. This resource summarizes research on how a bowel program can help you control bowel movements after spinal cord injury. This information can help people with SCI learn a bowel program that can help you avoid these problems and perhaps bowel surgery. A bowel program is necessary after a spinal cord injury because you may have problems moving waste through your colon or large intestine. You may pass a stool when you don't want to, or a stool may be hard to pass. You may have pain in your abdomen. When eating, you may feel full sooner than normal, or you may eat less than you usually do. You may experience depression or anxiety. It is very important to understand how your body works. Your stomach and small intestine pull nutrients from the food that you eat. Nutrients keep you strong and give you energy. The rest of the food becomes waste that your body doesn't need. Waste forms into a stool in your colon and rectum and leaves your body through the anus. The process of passing a stool through and out of your body is known as a bowel movement. If you have a spinal cord injury, this process may be tough for you. Spinal cord injuries may cause tightness or looseness in the muscles of the rectum, sphincters, and pelvic floor. The degree of tightness or looseness may be related to the severity or completeness and level of your injury. If your injury is above level T11, T12, then the muscles of your sphincters and pelvic floor may be tight, which leads to constipation. If your injury is level T11, T12, or lower, then these muscles may be loose, which leads to stool incontinence. What is a bowel program? A bowel program is a plan to retrain your body to have regular bowel movements. A doctor or nurse designs a bowel program specifically for you. Your health, bowel and personal history, and physical examination are an important part of this review. When designing a bowel program, your doctor may review the following: the level and completeness of your spinal cord injury, description and pattern of bowel problems, past and present medical problems, intake of food and drink, physical activities, need for or availability of resources, home environment, lifestyle, preferences, and gastrointestinal tests. The goals of the bowel program are to pass a stool every day or every other day, prevent unplanned bowel movements, empty your bowel around the same time of day, example morning, afternoon, or evening, pass medium or large stool, about 2 cups, every time you have a bowel movement, empty all or most of your rectum each day, have stools that are soft, formed, and bulky, and empty your bowel completely within 30 minutes, or 60 minutes at most, after eating. What is involved in a bowel program? Timing is involved in a bowel program. A bowel program is best when done every day or every other day. A program involves eating a good diet and drinking plenty of fluids, using bowel medicines as recommended by your doctor, practicing techniques that activate the reflex to empty your rectum, and using methods to clean out stools. Eating a good diet and drinking plenty of fluids are important in a bowel program. Natural fiber from fruits and vegetables increases the bulk of stool, making it easier to move through the colon. Doctors recommend 38 grams of fiber per day for men and 25 grams per day for women. When eating a diet high in fiber, you should drink plenty of fluids. Water is best. You may get constipated if you don't drink enough fluids. You should drink at least 2 or 3 quarts of fluids every day, unless told otherwise by your doctor. You should limit your intake of liquids with caffeine, example coffee, tea, or energy drinks. These drinks actually remove fluids from your body. Your doctor may have you take 1 or more medicines as part of bowel programs, either orally or rectally. Stool softeners make stools soft and easy to move. Stimulant laxatives stimulate the colon to move stools. Bulking laxatives add shape and form to stools and prevent diarrhea. Rectal laxatives help with rectal movement and emptying. Some medicines may cause constipation. They may be ones that you're taking already to reduce pain or muscle spasms or to treat depression. You may benefit from minimizing your use of these medicines under the supervision of your physician. Medicines to reduce pain, medicines to treat bladder spasms but slow down intestinal motility, medicines to stop muscle spasms all over the body, and medicines to treat depression. You can do 1 or more techniques to help you have a bowel movement and empty your rectum. You can do these at home or with help from a caregiver or nursing aide. Digital rectal stimulation. Move your fingertip in a small, gentle circular motion around the rectum or anus. This motion stimulates reflex of the rectum or anus. Be sure to cut your fingernails short to avoid trauma. Perform this technique for 20 seconds and repeat it every 5 to 10 minutes until the bowel program is completed and the rectum is empty. Digital removal of stool. Use your finger to remove stool from the rectum. This will speed up your ability to empty the rectum. Enema. Use a device to flush warm water into your rectum, which will help to empty it of stool. Examples of devices include the catheter enema or cone enema. What if a bowel program does not work? A serious injury may keep some people from carrying out a bowel program. For others, the program just may not work. Every person is different. Surgery may be a good option in a few cases. For example, if you can't achieve regular, complete bowel movements, which can lead to recurrent severe constipation, which is associated with frequent hospital admissions for stool loading and obstruction, chronic abdominal pain, prolonged more than 1 hour, difficult bowel programs, or severe autonomic dysreflexia. If you have frequent stool incontinence associated with pressure sores, or lack caregiver support, both of which may contribute to a poor quality of life and confinement in the home. There are 2 types of surgery. One is a colostomy, and the other is called an antegrade continence enema. For the colostomy, surgeons attach the colon to the abdominal wall through a hole called a stoma. A bag is attached to the stoma. Stools pass into the bag instead of through the rectum. You or a caregiver empty and change the bag easily and regularly. The colostomy promotes good bowel movements and is easy to manage by yourself or by a caregiver. The procedure prevents stool incontinence and unplanned bowel movements. It also decreases mental stress, so you can do more activities outside the home with family and friends. The other form of surgery is antegrade continence enema. Surgeons open the abdominal wall to create a tract to either the first part of the colon or the last part of the colon. You or a caregiver place an enema catheter through the stoma daily to flush the stool out of the colon with 500 to 1,000 milliliters of tap water. This process usually lasts from 30 to 60 minutes. Cleansing the colon daily and regularly prevents unplanned bowel movements and stool incontinence. For additional resources on spinal cord injury, please visit the Model Systems Knowledge Translation Center website at www.msktc.org.